He's kind of made hobby is not really the right word, Dr. Lombard. But you've been crunching these COVID stats since way back on containing COVID during the first wave, and the numbers now. I mean, I always had wished for you to have more numbers to crunch because I remember we'd have you on when it was zeros and ones, and it'd be like, okay, there's nothing really going on, and okay, and now, I mean, it's raining down numbers, Doc. So, what's your assessment of? Let's just catch up from the last time we spoke. During that time, what's your assessment of these numbers, these positives, these deaths?
Can you
Unmute
hear
that.
me?
Yeah, we got you. We got you.
Yeah, it's pretty sobering what we're seeing out there. It really just looks like unmitigated spread in the community. But when in fact we actually know it's not completely unmitigated spread because there's a whole lot of people actually still doing the right thing. Can you imagine how much worse things would be if probably the majority of the population still was not doing what they're supposed to be doing with social distancing and trying to stay home? And I have to believe that what we're doing to protect our vulnerable is still making a difference. But it's really crazy when you hear about the percentages that they're getting out in these more little pockets of communities out there. It's probably been like that for a little while too. I don't think that this is new. It's just that they're deciding to go out into these communities to test them. That would be my guess. That they probably have been sustaining these high rates for the past few weeks. And you know, again, the only good thing there is that it, hopefully eventually it burns itself out in those little pockets. But all these people in these multi-generational households, they're all going out into the community, and if they don't know they're sick, then they're not necessarily going to change their habits and behaviors, and that's how it continues to be a problem for the rest of the community. So I'm really glad that they're doing this. They're going out and identifying more people that are positive, and they have the contact tracers, and public health is right there to start telling them to isolate and to protect the rest of us. It's really pretty sobering. And again, we have to watch the hospitalization numbers. I don't know. I haven't been able to catch your show earlier today. Did they give any updates for today?
Lillian's coming on 8:30 or 9. But what we saw last week was we saw an all-time high in hospitalizations, and then I think like the day after it was broke. So
Right.
I mean, we've seen as high as 65.
Well, 62, I think, last week. But last night, according to the Guam Homeland Security's social media, it was 56 COVID patients at GMH, 10 receiving ICU level of care, 4 at GRMC, and then 3 at Naval Hospital.
Wow. Well, they went down into the 50s at GMH. That's a little surprising since they were still in the 60s as of Friday.
Mm-hmm.
Well, that's good news. But these increased numbers, are going to be, it's going to be a 2-week delay really before you see the hospitalizations come up. And the number of deaths are just going to follow the cases as well. So we're still on the thick of it. That's for sure. I guess I'd estimate now we're probably close to 25% of the population's been affected with quite a bit of margin of error there, but just kind of general rule of thumb. So it's a strange dichotomy, if you will. It's like we don't want to see the infection in the community more, but at the same time, the further along we get, the more under control this epidemic is going to be for us. And we're losing the race. I think the race to the vaccine, we're definitely losing it. I don't agree. You guys may have seen this declaration a bunch of scientists have signed online where they're advocating more for a controlled herd immunity sort of policy. I don't necessarily subscribe to that. I think that we've got to we have to continue to try to keep the numbers of deaths down as much as possible. And the way that you do that is by controlling the number of cases. So it's unfortunate. That's again, it's the only silver lining that we have is that the prevalence in Guam is up to the levels that it's at. But if you were just to allow this to continue in a more uncontrolled fashion than it already is, then we're just going to see more and more deaths and overwhelm our hospital system.
I was going to ask if you had a chance to see any of the presentations during the last press conference by Dr. Cabrera or Dr. David.
I did. It's impressive what they're doing, and they're looking at these things. It's the kind of thing that I wish they would do more of. it probably takes a lot of work for them to put something like that together, but it's impressive the kind of things that they're looking at in the stats. And you kind of assume that they are all along, but if they could put that in a way that's more easily shareable, or something that we can all look at and use to look at the data ourselves, crowdsource the information so that we can all sort of try to gain more insight into what's happening. I think, the more information we have, the better we can wrap our heads around what's happening in the community. And for some people, at least, that makes them a little more comfortable with what's happening just by understanding it a little bit better.
Right. Doc, I don't know if you had seen the governor's Facebook page, but this is something we talked about on the show. I think with Dr. Hoa had said that there was an effort, I don't know if it was through the PAG or through the governor's office, to kind of do some messaging out for the younger demographic, those who are 20 to, I believe...
20 to 40 or something.
Yeah.
In that age group.
And
the Gen Z, right?
The Gen Z or whatever it's called, right? And so we've had just a bunch of people come on and talk about, that demo is, they're going out, they don't care, they're gathering, they're spreading the virus to the, older people, more vulnerable people. And so I guess over the weekend we saw the big unveil. If we have this, can we put it up? Yeah. And it's basically their marketing campaign for this is, you are the vector, not the victim. The youth make up a majority of our COVID-19 cases, regardless of age. All of us play a role in fighting this virus. Wear your mask, social distance, and practice good hygiene.
I just WhatsApp to and two.
Yeah, and we just WhatsApped it to you, too.
Oh, yeah, I see it.
Yeah. And I was getting a ton of messages about this over the weekend. So what are your thoughts on that?
Were most of the messages positive?
Not really.
Yeah. I wouldn't guess so. I've seen this. I think it's something that was put out nationally in the U.S. I think if you're looking at this from the perspective of this is inevitable, the lockdowns aren't making any difference, and then you see something like this, it's going to make you feel like your opinion isn't valid, and so I'm not surprised that there's a lot of people out there that don't think this is very helpful at all.
Right.
They're just still trying to push their message, which is it's really, this is inevitable. This is normal for a respiratory virus. We have to learn to live with this, and we have to accept these deaths and maybe even more deaths in order for us to get to a place that we can finally truly return to normal. And that message isn't 100% invalid either. And that's the thing. It's that there's always some truth in everybody's message, and try to find that, but temper it against the costs. And I think that's what those on that side, they're much more willing to accept a certain level of cost, that cost being deaths. And some of us are not. We want to keep those deaths to the smallest number possible. And the real trouble, and the data is really messy. If you want to advocate that the lockdowns and closing businesses are causing hardship and morbidity, and there must be some truth to that for sure. But the data is so messy; it's going to be extremely difficult to tease out which hardships are coming from the lockdowns or from the business shutdown versus from the virus itself that are just going to be there no matter what. So. I don't think we're ever going to really know the answer to that. What we do know is that cases cause hospitalizations, which and then the deaths will follow, and that's what I feel like we have the best ability to act on.
I just think it's interesting that a lot of the messages I was getting was that, okay, last week they were blaming the Chookies for the spread. Now they're blaming the young people. I just think from a marketing standpoint, I understand how easy it is to copy paste something nationally. But how hard would it have been, I mean, at the onset of this data, because we've been talking about this for a couple months now, even more, how hard would it have been to find one freaking young person out there who takes it serious, who talks about, hey, I got Tanana over here, my grandma, and, that's why I take it serious. I mean, Jesus Christ, we have all these social media influencers. I could name, we got Frank the Crank, we got all these other people who put a lot of content out. How hard would it have been to approach one of these people and been like, hey, can we get you? You take it serious? Yeah, I do take it serious. Okay. I mean, that would have been a lot easier than being like, oh, you young people are killing everybody. It's your fault. I mean, I understand it's,
Mhm.
you know, it is what it is, I guess. But I'm just saying. Would have
Yeah,
been
and
much easier.
there's so many people have died now. I mean, it was not going to be hard to find somebody that's a family member of somebody who's passed who said, hey, you know, we don't necessarily know how this came into our house, but I have to take some responsibility for that. Maybe it was something that I did. If we saw some, you know, I don't know who would be willing to do something like that. It takes quite a bit of humility and courage to be able to come out and say that. But, you know, are they asking? You know, there may be some people that are absolutely willing to do that. And these are the lessons learned, which I've always felt like we've needed to hear from public health. What are the lessons learned when you actually go in and do a deep dive into just pick one case, one death, deep dive into what may have happened in that household and in their family and friends circumstance that led to that person getting the disease and then passing from it. I think there's tremendous amount to be learned, probably from every single case. And I don't think it would be hard to find some family members that are willing to talk about it. And that would be a great angle for us to try to, for the public service education piece.
Doc, in looking at the numbers, hospitalizations and the deaths, what are you forecasting for the next couple weeks? And I know it can't be good.
Well, the deaths still have been outpacing the calculations a little bit. So still looking maybe 8 to 12 deaths over the next couple weeks per week. We're still on a trajectory that shows increased cases, so that I expect that to just continue to go up.
We did have a comment here, Doc, about something with your clinic and a patient last week visited the office, was notified of positive results. Anything to this, Doc?
Yeah, we had so we've had 5 staff members. I think I mentioned this last time who have tested positive up to this point. None of them were related to one another. They've all been at sort of different times. We've had maybe 1 or 2 patients that have come through that eventually we have found out, that they were positive. They may have been positive by the time they came through. So this is a patient who, I'm just trying to be careful here. Right. Her significant other was told to test because the significant other's workplace had a positive. They're at the workplace. Both were asymptomatic. They went to go get a test. And they were waiting for the results. And because they were asymptomatic and it didn't sound like there was close contacts with the worker that was positive, we felt like it was okay for them to bring them into the clinic. So then pretty much as soon as she left the clinic, they got the result from public health that they were indeed positive. So we've identified the people that were closest proximity to her throughout her visit to our clinic. And to my knowledge, this person is still asymptomatic, and all of our staff, if it was a positive exposure, our staff would be, potentially becoming symptomatic now or testing positive now. So we're going to maintain a high sense of alert and make sure we're continuing to do what we do all the time. We, despite the fact that we've had 5 positive cases in our clinic, again, because I think we're doing the right things here, we haven't had any internal spread either from a patient, as far as we know, from a patient to a staff to staff, or staff to patient. So I have to believe that we're doing the right things. And and again, you look at asymptomatics, and while we do believe, especially pre-symptomatics may be at high risk of spreading the infection. Right. Truly asymptomatics, they're asymptomatic for their entire course, we think are fairly low risk, or certainly less risk of being infectious to others than those that are symptomatic. So it was a bit of a judgment call on my part, but my staff did ask me about that particular case, and I felt comfortable having her come in. So we're going to be, we'll be continuing to be as careful as we can, and we have an important job to do here, and we're trying to keep people's eye health safe and keep them seen while we're seeing still high volumes of patients coming in. We don't want them to miss their eye exams, and for those that, especially when we're still taking care of urgent eye care needs as well.
Thank you, Doc. And
Thanks,
be
Doc.
safe. Our thoughts and prayers, of course, always with you and the staff. And grab some virtual empanada on your way out, okay?
Oh, thank you. I'm starving. Thanks.
Great way to start a week. Great way to start a week. Thank you, Dr. Lombard.
All right. Take care. Good night. Good night.
Wash your hands.
Good morning.
Right on. Stay home. You're not the vector. Okay, we'll see you. 801. Hey, we're going to say thank you to our viewers on KUAM TV. It's been a great ride with you. It's always a great way to start a Monday. And we've got a whole bunch of great programming coming up on KUAM TV. My name is Chris.
I'm Sabrina.
Thank you, KUAM TV. Jump on over to our KUAM News Facebook live feed or the good old-fashioned right here on the radio. We're KUAM FM 93.9 and Hagatnia the Breeze. It's the link. KUAM TV. Está hechos. Back. Let's go through some of the comments here because Bree, I know I had come out and said how hard would it be to come up with a commercial with a bunch of young people